Good afternoon, everyone. The title of my poster is A Novel Anti-cfh Antibody Modulates Tumor Microenvironment and Robustly Inhibits Growth of cmt-167 Lung Tumors. Complement factor H is a protein that protects host cells, including tumor cells, from attack and destruction by the alternative pathway of complement-mediated cytotoxicity, and it is overexpressed in many different cancers, including lung cancer. We have shown previously that autoantibodies to complement factor H in lung cancer patients are correlated with better clinical outcome. So a fully recombinant antibody GT103 was developed that specifically targeted tumor cells in vitro by activating complement system and inhibited tumor growth in vivo. Here we show that GT103 was able to inhibit growth of tumors in cmt-167 syngeneic model of lung cancer and B16F10 ova melanoma model. It led to increased infiltration of dendritic cells and reduced influx of immunosuppressive Tregs and MDSCs. Depletion of B cells in these mice using anti-CD20 antibody completely abrogated the anti-tumor activity of GT103, confirming the role of B cells. Bulk RNA-seq studies on tumor tissue showed that GT103 triggered activation of B cell receptor signaling pathway, leukocyte chemotaxis and migration, interferon gamma production, and lymphocyte co-stimulation. We mapped the genes specific to these pathways and validated their expression by real-time PCR. Further, single-cell RNA-seq analysis of tumor-infiltrating leukocytes showed that B cell CD8 and CD4 positive T cells were found to be more abundant in GT103 treated group, while Tregs, neutrophils, and monocytes were less represented in these tumors. Analysis of the conserved markers in neutrophilic and monocytic clusters showed that these cells were immunosuppressive in nature, and GT103 reduced the percentage of both of these immunosuppressive cells in tumor microenvironment. In CD8 positive and CD4 positive T cells, GT103 upregulated positive regulators of T cell function, while downregulated negative regulators. The anti-apoptotic BCL2 was also found to be downregulated, suggesting that these cells are in their affected state. In Tregs, there was downregulation of transcription factor ID2 observed with GT103 and its downstream markers like IL1, RL1, KLRG1, and HIF1 alpha. Downregulation of ID2 is associated with loss of Treg function. So all these results show that GT103 inhibits the growth of cmt-167 tumors by creating a highly favorable tumor microenvironment characterized by enrichment and simultaneous activation of effector CD4, CD8 positive T cells along with B cells and reduction of immunosuppressive populations like monocytic MDSCs, neutrophils, and regulatory T cells. Thank you so much for your kind attention.